pieces of the Obamacare Act or Affordable Care Act that was implemented, that those that did have pre-existing conditions were not going to be looked at askant or marginalized in any way if they had any kind of issue. And you might talk a bit about that. And I understand that also those that are 26, you can stay on your parents, if you're under 26, you can stay on your parents' health care plan to that length of time and still get some cost reduction? Yeah, so that's a really good step in to what the Affordable Care Act has been doing. In 2010, March of 2010, some of these regulations were already put in place. As you mentioned, 26 years old can now get covered under their parents' plan, which they weren't able to do. 19-year-old up to the age of 19, children were able to be denied insurance. They're no longer able to be denied insurance. Preventative health care, where you have to pay a copay or a co-insurance just to get an annual checkup, that's no longer going to happen. People are going to get 100% coverage. Get your annual checkup, check their diabetes, check their cancer level tests, blood tests and all that. Excuse me. So those changes have occurred, but the bigger step that's occurring is in 2014, where universal health care comes in and everybody. The goal is not to have everybody insured. The goal is to have less uninsured people in California. And certainly to reduce the cost, if at all possible. And reduce the cost and have better quality care. Because as we see from past data, that health insurance cost has been going up in double digits. And with the new health reform, that rate is going to be regulated. It can't go down, it can't go up. It could only be done so if it's approved by the regulators. That is unreasonable to have this price the way it is. So the challenge is going to be a little bit harder to have these rate increases fluctuate so often.